reviewing a patient's current medications, begin by ensuring that you have a clear picture of everything the patient is taking. Your focus is not to delve into a detailed medication history, but rather to clarify the indications for each medication. This step is essential because it gives you the big picture of the patient's management plan before you start exploring their individual problems. Start by reviewing the medications list that has been provided. For each medication, ask clarifying questions to confirm its intended use. For example, you might say, "I see you are on Perindopril 5 mg once daily. Can you tell me if you are taking it for hypertension, heart failure, or another reason?" This approach not only confirms the indication, but also shows the patient that you are attentive to their treatment plan. Remember that patients may not always have an accurate understanding of why they are taking a specific medication. They might say they take Perindopril simply because they were told it's for high blood pressure. But as a candidate, you need to know that, in addition to treating hypertension, Perindopril is also used to manage proteinuria. Making such connections is key to your overall assessment. While you are confirming the indications, start integrating this information with the patient's past medical history. Note, if the medication's intended use aligns with the patient's reported conditions. For instance, if a patient has a history of hypertension and renal issues, the fact that they are on Perindopril might indicate that it's managing both conditions simultaneously. Document this integration in your notes, linking the medication to the clinical context. This not only validates the patient's regimen, but also helps you understand the bigger picture of their health status. Don't forget to ask about any over-the-counter medications, supplements, or herbal remedies the patient may be taking. These items can significantly impact the overall management plan, and sometimes patients might overlook them when listing their medications. Ask specific questions such as, "Are you taking any supplements or herbal remedies on a regular basis?" This extra step ensures that you have a complete medication profile. In addition, it is important to inquire about adherence. Ask the patient whether they have any difficulty following their medication regimen. Poor adherence might explain why a patient's condition is not well controlled, and it can provide clues about barriers to effective treatment. For example, if a patient mentions that they sometimes forget to take their medication, this might be a factor in their ongoing symptoms, and it is important to note this in your assessment. After confirming the indications and exploring adherence, take a moment to summarize what you have learned about the patient's medication profile. This summary can serve as the basis for your preliminary past medical history documentation. It will help you tie together the clinical picture by highlighting how the medications contribute to both managing active problems and addressing past or inactive issues. For example, if the patient is taking multiple medications for chronic conditions, note whether these medications are effectively managing those conditions, or if there appears to be any overlap or redundancy that might need further evaluation. By approaching the patient's current medications in this structured way, you not only ensure that you understand the purpose behind each medication, but also set the stage for deeper exploration of the patient's overall clinical status. This method allows you to quickly grasp the rationale behind the treatment plan and to identify any potential gaps or discrepancies that might be significant in the context of their overall care. In summary, when reviewing a patient's current medications, clarify the indications for each drug through direct questioning. Integrate this information with the patient's medical history, and inquire about over-the-counter products and adherence issues. This systematic approach enables you to form a comprehensive understanding of the patient's treatment plan, which is crucial for both your exam performance and your future clinical practice.